Doctor, I'd like to share why pharmacogenomic or PGX and metabolic testing isn't just beneficial, it's medically necessary for your patients, especially in cardiology. Pharmacogenomic testing identifies how a patient's genes affect their response to medications. In cardiology, this is critical because many drugs such as beta blockers, anticoagulants like warfarin or clopidogrel statins, ACC inhibitors, and antiarrhythmics are metabolized by genetically variable enzymes, especially those in the cytochrome P450 family. Without this knowledge, patients may be prescribed a drug they metabolize too quickly or too slowly. This can result in subtherapeutic effects or toxic adverse events, such as excessive bleeding with warfarin or ineffectiveness of clopidogrel due to CYP2C19 poor metabolism. These risks can be mitigated by testing before treatment decisions are made. Metabolism isn't visible. You can't accurately determine someone's metabolic rate or enzyme functionality by looking at them. A muscular patient might be a poor metabolizer, and a frail patient could be an ultra-rapid metabolizer. This is why genetic testing is essential. Clinical features alone are not predictive of metabolic pathways. Genetic polymorphisms in metabolizing enzymes mean that two patients of the same weight, age, and race may metabolize a drug completely differently. This variation affects efficacy, side effect profiles, and long-term outcomes, especially in chronic cardiovascular management. One-size-fits-all prescribing is not just outdated, it's risky. Here's a case: a 67-year-old male with atrial fibrillation, hypertension, and hyperlipidemia is placed on clopidogrel post-stent. 6 months later, he suffers a non-STEMI despite adherence. PGX testing reveals he's a CYP2C19 poor metabolizer, unable to activate clopidogrel effectively. Switch to prasugrel. Outcome stabilizes. PGX testing prevented further ischemic events and informed the choice of anticoagulant, also avoiding unnecessary dose escalation or polypharmacy. Why order these tests? Patient safety, precision prescribing, cost savings, enhanced adherence, and clear documentation of medical necessity, especially under CMS and CPIC guidelines. Patients benefit from fewer side effects and hospitalizations faster, therapeutic success, increased compliance, long-term cardiovascular stability, and clear rationale for medication changes. Doctor, when we combine cardiology with pharmacogenomics and metabolic precision, we move from reactive care to proactive protection. That is the future of evidence-based cardiovascular medicine, and it starts with these tests.